So, this is Mental Health Month, and I'm still talking about depression. Thank you, Pastor Pope, for the powerful um, Proverbs 18:1. Look it up. So, I want to give you some more symptoms. And again, go back to some of my earlier videos where I talked about depression and the symptoms of depression. Reach out for help, look into resources, NAMI, NAMI.org. I found a good article from Good Housekeeping that talked about different types of depression, and I even learned some things from it. So I want you to keep in mind, I'm intentionally filming. There's a heaviness, a sadness that comes with clinical depression. So, a dark place, as someone on Haven Today reminded us of just a week or two ago. Look that program up. It was an individual. She's dealt with depression for years, and it was just it's good to hear the voice of depression, because there are times that individuals who are feeling depressed feel voiceless. They feel like they don't have a voice. They can't be heard. They can't be seen. They're not able to do things that they usually do, things they're interested in. They're not able to be around people who they're normally able to call and keep in contact with. It actually pulls them away from their support systems and from their life. It creates an isolation. It creates a heaviness. Sometimes I've been told that the individual does not know what they're feeling because the heaviness is so great. And even if you are of the faith community, you may even refer to it as a spirit. Make sure that's in line with your faith and not your symptoms. Symptoms can actually tell us a lot about what you're feeling. It's important for you to find a good therapist, counselor, a good psychiatrist, nurse practitioner, a good individual to help you with your care, knowing whether you need talk therapy. You may need intense talk therapy at least once a week. It may require more than once a week if you're in crisis. Make sure that you have enough tools in place, skills, coping skills, so that you can actually know when you feel triggered in this way, you know what to do. It may require medication, prescribed medication. Please, 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 please do not use this as an opportunity to use substances of any type, because that will only make things more difficult for you and cause you to go into a darker place. So whatever the substance, whether it's legal or illegal, substances, we consider that to be self-medicating. So instead of going to a doctor, you're choosing to actually find something, whether it's alcohol, whether it is cannabis, whether it is whatever substance it is for you. Because unfortunately, you may be the person who gets creative with your substances. So that's why I'm saying any substance is a no-no, because it will only make your symptoms worse. Even if it appears that it's better for a time. I hope this has been helpful. I don't always do longs, but Mr. Ray asks me from time to time to do a long, and this required a little more as always, know that you can do this. Seek out help if you need to. There are resources around. In Maryland, we have NAMI, which is a national organization. We have talk to your primary care physician. They are so knowledgeable about so many things and can help to refer you, get you to the right place, help start the treatment process. And we have the health department. So wherever you live, there's some type of health department. Reach out. 211 in Maryland is a resource, and 988 is a helpline where you can call, text. If you are in crisis and you have thoughts of harming yourself, get to the nearest emergency room. Call 911, 988. Tell someone. Seek out the help that you need. Take care of yourself. Be well.